A brain in trauma or in high levels of emotional stress can alter gut chemistry in ways that will wipe out entire populations of healthy bacterial species, throwing the whole gut ecology right out of balance. Unhealed emotional pain goes straight to the gut. And that's how childhood developmental trauma tunes the immune system towards systemic inflammation. Traumas that afflict us in our formative years hit particularly hard. These are traumas such as early separation from family, dysfunctional relationships at home, authoritarian or punitive parenting, physical or sexual abuse, etc. Now, all of these can send the gut down an inflammatory track, which then conditions the body for a host of chronic diseases later in life. There's an enormous body of research famously kick-started by the Adverse Childhood Experiences study of the 1990s, which was a joint venture of the Center for Disease Control and the Kaiser Permanente Hospital in the USA. And this very large study on the lifelong impacts of childhood trauma, which gave rise to a wave of follow-up studies all around the world, proved to be nothing less than a major turning point, which absolutely revolutionized how the world understands the lifetime effects of childhood trauma. Now, what this body of research so graphically illustrates is the way that psychology becomes biology. Now, here's just a glimpse at what the researchers found. When an individual has suffered a high level of traumatic childhood experiences, this can increase the risk of a whole host of chronic inflammatory diseases later in life, including, but not limited to, for example, heart disease, 220% greater risk. Stroke, 160%. The various pulmonary diseases, up by 390%. Depression, 460%. So adverse childhood experiences are also understood to be an important factor driving the incidence of some cancers as well.